Hello, my dear friends. How are you? Myself is Professor Dr. Rajendra Deshpande, and I am making a serial. Let's the Ayurveda knowledge make viral. Let everybody should know little bit about Ayurveda. That's why these videos are very short and sweet. So I expect that you please circulate my these particular audio video sessions because everybody must know a little bit about Ayurveda every day. Today I am going to talk to you about the Ayurvedic Samhitas or Ayurvedic text. I am very glad to tell you that since a long time, when there was a time of the knowledge, era of knowledge, that is called as a Vedic era. Try to understand Vedic era. So there were four important Veda. What is Veda? Vidavindati is an original Sanskrit word to understand, to gain the knowledge. So there were four huge reference books which were carried, the knowledge was carried through generation to generation just by hearing and just by spoken to the next generation. Again hearing, again telling to the next generation. But after, when the printing system exists on this earth, then all this knowledge is converted in the handwritten scripts and then also printed matter. Now we are having a big 4 volumes of Ruga Veda, Atharva Veda, Yajurveda and Samaveda. I think everybody knows these are the huge encyclopedia of knowledge in Indian culture. Veda are encyclopedia of knowledge in Indian culture. Ruga Veda is basically consists of different sacrifices systems and the mantras or the verbal or the audios which are very effective in manipulating, in treating the different physiological and pathological aspect of the human body. So that is Rigveda. Then Yajurveda. Yajurveda explains the different techniques to be performed to get a normal physiology and understanding of the human body. Then there is the Atharva Veda. Atharva Veda comprises of different knowledge of different system, and one of the system is also health science. Atharva Veda has a lot of references regarding the human physiology, human anatomy and human health, and that is why Ayurveda is said to be originally generated or extracted from this encyclopedia that is Atharva Veda. So Ayurveda is called as Upanga of Atharva Veda. So it is extracted, knowledge is extracted from Atharva Veda. And last is a Samaveda. Samaveda having a musical technique, musical effect on the human body, on the physiology and the health. So these encyclopedia of the knowledge then are converted to the specific reference books of Ayurveda. These reference books are classified in 2 sectors. One is called as a Bruhat Trayi. Understand the word. Bruhat is a big knowledge content. Knowledge wise they are big. Content wise they are big. Information principles wise they are very big. I am not saying only the pages number, but the content, essence of that knowledge is very big. That's why they are called as a Bruhat Trayi. Trayi means 3. 3 reference books are there. And then Laghut Trayi. Laghut Trayi is comparatively small in their information, small in their content, small in their essence of the principles. So Bruhat Trayi 3. Laghut Trayi also 3. I will give the names. First name is a Charaka Samhita. This name you must remember when you want to study about Ayurveda. What is the book? Original reference book? Charaka Samhita, which is being learned by all Ayurvedic learners. Everybody must know, must study, must understand the Charaka Samhita. Charaka Samhita is written by the Charaka Rushi. Charaka is the name of a person, remember. And why the name Charak? It is very interesting. He is supposed to wander, to move all around the world and then all around his territory, and he gathered the knowledge. He looked for many things. He observed many things. He make experiments and then he convey all his knowledge to his disciples. And that's why Charaka is a name. Charaiveti means to move around and to gather the knowledge. So Charaka Samhita. Samhita is a text book. Samhita is a compendia. So Charaka Samhita is written by Charaka Rushi, Charaka Seer, Charaka scholar, Charaka person, Charaka Ayurvedic scientist, Charaka Samhita. What is the speciality of this Charaka Samhita? This is the masterpiece in the internal medicine. Charaka Samhita is like a Bible, is like a Quran, is like a Gita. That means it's like a religious. Ayurveda is like a, what you can say, the performed to be very honoredly. So that's why this is our duty to maintain, to keep the health of the person. To maintain the health of the person, there is no alternative to study the original Charaka Samhita. Remember my words, Charaka Samhita for internal medicines. That's why it is said, Charakastu Chikitsite. Try to understand, Charakastu Chikitsite. Chikitsa means treatment. If you want to learn, if you want to study, if you want to understand, if you want to perform any Ayurvedic management, there should be most important principles that are given in Charaka Samhita. I am saying Charaka Samhita is best for internal medicine at the level of principles. This word is very, very important because there is always confusion. I will remove that confusion afterwards, misunderstanding afterwards. But remember my words. Charaka Samhita, what is the speciality? Charaka Samhita is giving the principles of Ayurvedic management. I am not saying it is giving the ready-made drugs. Drugs may be different, but principles that he has mentioned is still time-tested and to be followed at this time. Second is a Sushruta Samhita. Sushruta. Sushruta is one of the name of the person who is following the school of thoughts of surgery. So he is from the surgery master. And Sushrut is name mentioned in the Ayurveda modern surgical books as a father of surgery. Who is Sushrut? Father of surgery. So he has written Sushruta Samhita. Samhita is a book. So Sushrut Samhita is written by Sushrut. Charak Samhita is written by the Charak. Now next, Ashtanga Sangraha or Ashtanga Rudaya. These are the names of the books, but these are not the name of a person. Ashtanga Rudaya is written by Vagbhat. The name of the person is Vagbhat. He has written Ashtanga Rudaya. Ashtang, I have already explained in another video. There are 8 branches of Ayurveda. Kaya, Bala, Graha, Urdhvanga, Shalya, Drashtra, Jalavrisha. 8 branches are described. It's like a digest. It's like a concised edition of Charak and Sushrut. Vagbhat was very clever. He has born after the Charak and Sushrut. So what he has done? He has done Ayurveda much simplified because he has gathered all the information, extracts from the Charak Sushrut, and he has written a very good digest book, very simple to understand in a poetic manner. And that Vagbhat, Ashtanga Rudaya, this particular Grantha is very, very popular all over the India, but especially South India. There are so many families who has mugged up, who has learned all the Ashtanga Rudaya, tip of the tongue. They have mugged up all this Ashtanga Rudaya and they are practicing according to their principles. Now Laghutrayi. Laghutrayi, Madhava Nidana. Madhava Nidana, Nidan is a causative factor. Nidan is a diagnostic. So Nidane Madhava Sreshtha. Nidane, if you want to diagnose the person properly, the clinical features are best mentioned in the book Madhava Nidan. Next, very latest, Sharangdhara Samhita. Samhita Compendia. Who is the author? Sharangdhara. Then Yogaratnakar. This is also name of the book. Sharangdhara Samhita, Madhava Nidan and Yogaratnakar. These are called as Laghutrayi. 3 tired, small triad, and these are the big triad, Bruhatrayi and Laghutrayi. So these are the 6 texts that are referred by the Ayurvedic students, by Ayurvedic teachers, by Ayurvedic scientists. Now in this era, there are a lot of textbooks have been also developed. Indian, that means this particular, you must understand that Ayurvedic text or Ayurveda has become so globally popular. That's why these books are not only now Sanskrit or the Hindi or the English language, but they are in many national or international languages. Charaka Samhita is available in German language as well, in English as well. So Ayurvedic books, Ayurvedic reference books are available throughout the world, and that should be considered while you want to talk about Ayurveda. I hope this basic information about how we should gain the Ayurvedic knowledge from the original text of Ayurveda like Atharva Veda, then Bruhatatri and Lagutri. Everybody will remember these words. Charaka Samhita, medicine. Sushruta Samhita, surgery. Ashtanga Hruday, digest of Ayurveda. Then Nidane, Madhava Sreshta, Yoga Ratnakar and Sharangar Samhita. Thank you very much, my dear friends. I wish you all the best. Take care of yourself. Please subscribe my YouTube channel and join this venture of propagation of Ayurveda. Thank you very much.